Angelyn, Moultrie, Lizana, and I am a family practice physician. I went to medical school at College of Osteopathic Medicine of the Pacific, now known as Western University of Health Sciences in Pomona, California. Rotating internship at Tucson General Hospital, and I did my residency at Doctors Hospital of Montclair in Montclair, California. My mom was a registered nurse, and so I used to read her nursing journals. When they would come to the house, they'd have all kinds of gory pictures, which my sisters hated to look at, but I loved to look at them, and I liked science, and so it just was a natural progression as I went from high school to college and then to medical school. As a family practitioner, we see everybody from babies to elderly, and so you get to see everybody, and you get to see kids as they grow up to become adults as well. So with osteopathic medicine, we are trained the same as MDs in the medical part, but we're also trained at 200 additional hours of hands-on medicine, manual medicine as it's called. We believe that the body inherently can heal itself given the right circumstances, the right situations, and so with osteopathic medical, that's how we're trained. We're trained to look at the entire body and then going from the entire body, not just one specific symptom, to find the diagnosis and what's going on with the person. So, of course, you need to be caring, you need to be compassionate, you need to think about what's going on with the person. What are they coming to your office for? What is the reason for their being there for that particular visit? You want to make sure that you're, picking up on their verbal and their nonverbal cues. So it's not just one thing, you just have to kind of be a detective of sorts. I think everybody needs an outlet of some sort. My husband is in the Air Force. My first job out of residency, I was a contract physician at Los Angeles Air Force Base, and he was in the Air Force. That's how we met. So I called my husband and I said, hey, I'm joining the Navy. I'm actually a captain in the United States Navy Reserve, so I do Navy medicine, which is actually different. I'm a family practitioner in the Navy, but Navy medicine that I do is different from my day-to-day medicine in the office. An interesting thing that happened actually last week, this is a true story, a patient that I have not seen for years, she's now in her 20s, she told me last week, she says, you used to make me so mad whenever you asked me about my grades because you would say that I could do better, because my grades were never very good. And she says, now that I'm an adult, I can see that you were doing for me. You were trying to make me to do better. So she says, I wish I would have listened to you, but now I get it. Now I get it. Now she's got a baby. She's like, now I get it. Plant that seed that they can do it no matter who they are.